Everest Village, Exalt Health, Inpatient Rehabilitation Hospital, 92 Auburndale, and the building is located back there. And this is the entrance coming from Lakeland, coming from Auburndale. Let's get into this video.
Rehabilitation Hospital, okay.
All right, BB. We are in Auburndale. Invitational tour of this facility. All right, BB, let me ask you a few questions. You do offer a supplementary insurance?
Supplement insurance, yes.
Okay, and then if someone is on disability before the age of 65, or they just got disability, or they've been on disability, you can help them out as well, finding a insurance?
Yes.
Okay.
Yes.
Well, let's go. Go ahead.
Yeah, anytime you get on disability, you qualify for Medicare. So, you want to make sure you get on a good insurance to get with an insurance agent. And sometimes, depending on how you got it, if you went through an attorney, some attorneys will connect you with Medicare.gov. They'll reach out to you. Sometimes they don't get you in contact. They think just by telling you, you're going to know. And that doesn't always happen. And I had a client that didn't know, but luckily she fell into the category before her time was up, so she didn't get penalized with an IRMA. So keep that in mind, guys.
And the difference between you and calling the .govs or dealing with insurance companies is that people deal with you, a person, versus waiting on hold,
right,
pressing buttons, dial 9.
I'm going to be the one that's doing the legwork. So if you have prescription issues, I'm the one calling the insurance agency and saying, listen, we went through this, it was covered, why isn't it not covered now?
Same thing with doctors.
Same thing with doctors. So you get into a doctor's office, at one point you're just not working together well, you're not meshing together, and you want another doctor. It's easier to go through that with an agent than trying to call the insurance company up.
And you're throughout the state of Florida. You do
Yes.
live in Polk County.
Mm-hmm.
You do Dade City, Zephyr Hills, Plant
Polk,
City, Winter Haven, all of them.
Everywhere.
Right. And right now we are in Auburndale.
Yes, this is a new facility that's just opened up recently, so they do inpatient rehabilitation services. This isn't for long term. This is like you broke a hip or you've had a knee replacement. So this is to help get you back on your feet quicker than trying to do it at home.
And this is 1080 92 before the Parkway, before the Auburndale Flea Market. So if you pass the Auburndale Flea Market, you have passed this establishment, and that is what it is called. Smells like a brand new car in here.
So Andy said that y'all gotta come see the place.
Well, it's good because nobody knows you're here.
And nothing is impossible. The word itself says, I'm impossible. Congratulations and continued health.
She's like, I don't know what I'm going to do for rehab, so, and then...
Right. Yeah, so you're short-term. Do you want me to tell you all this stuff?
Yeah, go for it. Because you're saying right now there's no sign out there right now?
There's no sign, but we're right off the Polk Parkway. You get off on exit 17 and towards Lakeland and pull right in the parking lot. So we are a 36-bed, all-private room rehab hospital. So you don't need to have a skilled nursing stay. You don't need to have a hospital stay to come here. If patients are just getting a little weak, they can come right in directly from home, from their doctor's office, whatever. And then since we are a full hospital, we do everything. A physician sees you every single day.
Rehab,
Everything. We
physical,
can do
occupational,
physical,
speech.
occupational, speech, 3 hours a day of therapy. So every day that you're here.
And you take what type of insurance?
So right now we are only accepting traditional Medicare, but we are currently getting the contracts for everything else. So
Okay.
when you first open, you have to do so many free patients. Then they give you your Medicare license, and then you can see traditional Medicare as you apply for the others.
Okay.
So we've been open since March, so we're hoping that those will start coming through soon. I've heard like Care Plus is pretty easy, and a couple of other ones. And then UHC and Humana, which are huge here in Polk County, will probably be at least 6 months out. So.
All right.
Both are inpatient therapy. This one does say outpatient therapy, but they're both inpatient. So our first gym here, lots of light, lots of really state-of-the-art equipment. Nothing. These patients are going to be on both spectrums. They can come fresh stroke and not have very much mobility, or maybe just like a little hip fracture. So they may be coming from here, going straight home directly to like a gym membership.
Gotcha.
Yeah. With bathrooms in a gym, so patients don't need to go all the way back to their rooms.
Right.
There's no getting out of therapy.
And I do like to use that one a lot.
Yes. So since we are a hospital, people may come in off the street, labor, having a heart attack, whatever the case is. So we do have this treatment room with a code cart. We can get them situated while we call 911.
And get them to a
Get
bigger,
them
better
to,
place.
yes, exactly. But at least we can treat them, stabilize them, whatever.
Yeah, and so help.
And we have,
So
full
they-
staff here. Physicians are here during the day, typically not at night. But RNs, things like that. Everybody's here. We can run whatever we need to run.
Right.
Then here's our second hand. I'm not a physical therapist, so I don't know a lot about the equipment. But this big machine over here is a balance machine. You get on it, things get moved around, and it really, really helps patients. Hand sanitizer hit me. Helps them like regain their balance and work on that during their stay. So a little bit more equipment here, and then we have this nice outdoor area. Lots of different turf out here, different levels of steps. They may be coming home with a walker and have never used anything before. How do I get up the stairs? How do I walk on this type of pavement? Winding paths, ramps, little putting green.
And now, do people stay here at night or no?
Yes. Yes.
And what's the days? How many?
About 7 to 10 days max.
Is it 7 to 10
Yes.
days max?
It
Is this a
does
smoking
depend.
facility?
No smoking at all.
Okay.
Nowhere on the facility can you smoke. So
Okay.
absolutely not.
So it just depends on how long or the injury
So
that they stay here?
insurance is going to dictate that.
How many days?
Diagnosis is going to dictate that. Actual, prior level of function to their goal is all going to come into effect with this. So, yeah, absolutely. It just depends.
Even with original Medicare, it's all that
Yes.
goes into play.
Yep.
Gotcha.
Absolutely.
You like if it tells you you have 14 days, that doesn't necessarily mean you have to be here 14
Correct.
days. If you start regaining your functionality back sooner than that, that's the goal. Then you're able to go home faster.
So you got 2 gyms.
Yeah.
You know how many staff is going to be here, or?
So we will have one therapist to every 6 patients.
Okay.
Most of the therapy is one-on-one. Occupational therapy most of the time does a little group fitness during the day. At least one of those hours is kind of group fitness.
And the night stay, or if you stay up to 7 days, what's the capacity in this building here?
36.
Okay.
So we have 36
So you're
private
getting
rooms.
basically individual care. You're not just getting a
Correct.
room of
Very-
100 people that.
Yes. No,
Right.
very individualized.
Right.
Everybody gets their eval and then what they need.
Right. So that's good. Yeah. Because when you have a low stay, then everyone's going to get individual
Two,
cares.
When the elderly think of inpatient therapy, they automatically think nursing home. And they're already afraid, once I go, I'm not coming out.
Yes,
And
and
that's
we
a-
do not let you stay here.
And
Get out.
that's another thing. If you happen to be here 7 days and a husband or wife, can someone come visit you?
Yes, absolutely. So And somebody can stay with you. We
Okay.
do not offer them a bed. They would have to stay in a recliner, kind of like the hospital.
Correct, right.
But yes, if they need somebody here.
Like if it was a spouse or a mother of a child or.
Absolutely.
Gotcha.
Yes.
Okay.
Yes. A
So that's
sitter,
good.
If you have a hired caregiver and they need to stay with you, maybe, they wander at night or something like that.
Gotcha.
They can stay too.
Okay. Sweet.
Yeah. Down here, this is case management, this big conference room. And then we'll go in here. This is our ADL suite. This is where we let everybody practice prior to going home. So a lot of people don't have a hospital bed at home. They have a big high bed that they share with their husband. They need to be able to make the bed. They need to be able to get in the bed. Same with kitchen. How do you use your brand new walker? Get in the fridge without tripping, falling, opening the dishwasher, the oven, those kinds of things.
So this is where you would stay for your 7 days?
No. They don't stay in here.
Well, what I'm saying is
This
is where you would come for a
No. Before they go home, they have to be able to demonstrate
Gotcha.
that they can make the bed.
Yeah.
They're able, like if you have a walker.
So this is
It's
like a
kind of-
simulation of your house.
Yes.
And basically you got your washing machine, dryer, bed.
Right. So
And
if you're
kitchen.
with a walker all the time, and they're telling you have to have this walker for your balance.
Right.
So you're trying to figure out how I'm gonna have a walker here, open my oven
Cool.
without hurting myself. Same with the
Exactly.
refrigerator. How am I
Gotcha.
gonna open this with a walker here and get things out and then scoot the walker this way to put it on the counter?
Right.
This is what we call a demonstration room. This is
Yeah.
to practice before you go home.
So
And
this
then
is the
same
demonstration
bathroom,
room.
Because all the bathrooms here that our patients are showering
Are
are
handicap
just rolling
equipped.
right in. This is an actual tub, which most people still have at home.
Yes.
Can't afford to get that redone, so
Mhm.
how are they gonna get in and out safely?
With a walker and doing that whole stepping in
Yes.
when you're in your 70s and 80s and you've got a bad hip or a bad
Yeah.
knee.
Gotcha.
Yes. Well, especially after hip fracture, Parkinson's, stroke, those are our
Mhm.
main types of patients that we'll be seeing.
That is awesome because a lot of facilities,
They don't offer.
they don't have demonstration rooms.
Right.
And yeah, that is nice.
So we are in the process of credentialing all of our physicians. Once we have our nephrologist on, we will be able to do dialysis at bedside in all 36 rooms.
Beautiful.
So we will have that option. Nobody needs to get shipped out to do dialysis. Nothing of that nature.
So you can do everything, rehab, dialysis, everything in one spot.
These rooms, they're all set up they're all set up the same. This one's shorter, longest, and then this one's in the middle. And we'll come down here to our,
Now that station we just passed there, is that the nurse's station? there?
Yes.
Okay.
yes. So our nurses sit right there centrally. No patients can walk out of here. And then all the doors at the end of the halls have alarms. So they know what's going on all
Right.
the time. Right in this room. So
We have one of ours, we, put
Right.
it on.
all of our rooms are set up exactly the same. Every room has its own bathroom. So as you come in, all the DME will be in here. Every single room has a shower chair, roll-in shower if they needed to roll in.
Yeah.
Nice height of a sink.
And this is where you would be staying at.
This is
Yes.
where you would be staying. So, here's your bed. Nice big screen TV. Very comfortable. Every room has the nice big windows.
Yes,
The
so you
windows do open.
Okay.
So, not right now, but maybe in the spring it would be nice to have.
Or in the fall,
Yeah.
yes.
And then we have this really nice procedure
Oh,
light.
yes,
So
that's so
something's
nice.
going on, a patient has a wound or their catheter
Right.
needs to be changed in the middle of the night, we can take care of everything.
Beautiful.
We don't have to bring them anywhere else. Everything can be done here.
And then that's where the second person.
That would be where.
Yeah, because it's a recliner like the
Yes.
hospital's chair.
And then 2 of our rooms have ceiling Hoyer lifts that can lift up to 1,000 pounds. We probably wouldn't see patients that large here only because their therapy would look a little different.
Yes.
but it is possible and it is a potential. You know,
Yeah.
we obviously wouldn't turn anybody away. We have bariatric equipment, so if that is needed for any patients, we switch out the regular size bed and we can bring in bariatric beds. We have bariatric wheelchairs, everything like that.
Beautiful.
And then we also have 2 negative pressure rooms. So if patients are on isolation, they still can come here. Therapy would look a little different, but you know, maybe they just have 2 days of COVID isolation left or something.
Right.
You know, they can at least come here, get started on their therapy, be removed. If they're tuberculosis or something else like that, we can still take them, but like I said, therapy would be different. We wouldn't be
Yes.
able to use
Put them
the
in
equipment.
general population.
So it's an option. You never know.
That's
you
true.
never know.
You never know.
So yeah, so that's basically it. We, like I said, we're credentialing all of our physicians, so we will have infectious disease, pulmonology, cardiology, wound care, nephrology.
Which is dialysis.
Probably missing something, but we will have all of the specialties here. So even patients that are a little unstable can still come with that physician oversight, and we can take care of them. So we're
Very
a full
good.
pharmacy. We draw labs whenever they're needed, and we use LabCorp, so they pick up pretty quick. We get
Yes.
results back within hours, and then can treat the patient accordingly.
Beautiful.
Yeah. Yeah, and these, like, the lights, they stay on just like that. There's like 3 lights on in here. In the evening, they lower everything, so it's...
Yeah, so when you have if you want your door open, it don't
Yes.
look like Tampa Stadium out.
Yes.
in the hallway.
Exactly, so they get that rest
Right,
that's
and then
needed
these are all the
during work.
rooms. And it takes you right to the gym, which isn't that far.
No.
And the left is more rooms there,
Yes.
correct? Okay.
Yes.
That's the longer
Yes,
hallway.
That's the longer
Gotcha.
hall. Has 15 rooms down it. Yeah, so that's everything.
There we go. And this is the station that would be to the left of me.
Meals and everything are.
Yes, meals are all included. Patients do eat in their rooms. We have a cafeteria, and anybody can go down there, but we don't like serve cafeteria style. So
Gotcha.
their meals are brought to their rooms.
The cafeteria's this way?
Yes. So we'll walk down this way.
Which is good, because some people, family members like to bring
Yes.
something and then they can go eat together.
And we've had people down there like playing cards, you know,
Yeah.
hanging out, stuff like that. There's our pharmacy, and then here's our cafeteria. We do keep like coffee and tea and water out, so they can walk down here, grab a drink whenever they want, or the nurse will get it for them.
Yeah. And then if it's beautiful outside, you even offer you outside dining. Would be a buffet. You got your coffee, your teas, your drinks. Very spacious. Very nice. Look at that. Sweet tea, Coke products.
They can text me, call me, my email's on there.
Perfect.
So, yeah.
So this is a new facility, rehab here in Auburndale. And they're accepting patients. And you heard it all. This is the pharmacy right here where you said that's the inside pharmacy.
Yes.
Okay. Just want to make sure, get it in there.
Okay, you're not allowed in there.
No. Just took a picture of the sign there. That's all, so that they know that that's where the pharmacy is located.
No, thank you for letting us come
Yeah.
over.
I'll give you some of my cards that we
Yes.
just so you have them. And then the cell phone, like that you've been texting, is my
Alrighty, we just did a full tour of Exec Health right here. Any questions, you can call Michelle and she'd be happy to help you out. But
But as of right now, they're only taking original Medicare patients. They're trying to get the contracts in place for the Medicare Advantage. So as soon as Michelle lets me know that those are a go-ahead, I'll let you guys know.
It'd be on the Facebook.
It'll be on the Facebook business page of BB Does Insurance on Facebook. But you don't, this is perfect for just a person, like I said, you know, you're getting a knee replacement, you've had a hip surgery, you've had minor surgery, but you know you're going to need a little extra help regaining your strength back. This is perfect. You know, you're in and out. They don't want to keep you. Like, come and visit, but we're going to toss you out.
And the other good thing is that it's a small facility, so you are going to have individual care.
Yeah, more one-on-one care.
Yeah, and it has a simulation room of a house, which I personally never seen them. I'm sure they're out there. This is the first time I've seen a simulation of making the bed, doing the wash machine, working the sink, opening the refrigerator.
Usually in a regular rehab facility, which is attached to a long-term, you don't have that. They take you into like the rehab room, you know, but they got a bed that's lower. Well, a lot of people today have beds that are higher,
right? Like
ours, you know, like we go to get on our bed, we have to literally up and, you know, scooch your butt.
But it has a whole room of, like literally a house.
Whether you're
it's a bathroom, kitchen, washer, dryer, and a bedroom.
And it's whether you're having to learn how to use a walker or a cane or any, you know, mobility device to help you get better and get you back on your feet.
All right, BB. From Exalt Health Inpatient Rehabilitation Hospital. Regaining independence through exceptional care.
And you are getting one-on-one care.
That's right here in Auburndale. And again, you can get in touch with Michelle. That's the information. That's the name of the place. And here is the building. There is the Polk Parkway. There is the Auburndale Flea Market. So if you pass the Auburndale Flea Market,
you've gone too far.
If you're coming from Winter Haven, you go underneath the Polk Parkway and you make a right, and they have a little sign out there. If you're coming from Lakeland on 92, if you don't pass that Polk Parkway, if you pass the Polk Parkway, you've passed the building. It'll be on your left. So absolutely. Left, east, right, west on Highway 92, 1080.
So until then, everybody take care of one another, take care of yourselves. See ya.
And this is the side of the building.
It's the main entrance.
Nice little cute facility.
Plenty of parking, and I like that it's, you look out, see grass, trees.